So you're doing squats, and out of the blue, your back has started to bother you. As a physical therapist, I have seen and treated this many times. In fact, before I became a physical therapist, I was in the same boat as you. I herniated a disc in my low back while squatting. Now, because of this unpleasant experience, I have a little more insight as to what's going on. When it comes to back pain, everybody's always talking about core strengthening, and more core strengthening. Now, core strengthening is definitely a good and necessary thing, and many people would benefit from adding this to their routine. The question is this really the most important thing that we can do to fix the low back when lifting? Because the reality is, many of us who have been lifting for a long time already have decent core strength. More than likely, the back pain is being caused by tightness of your hips or ankles, which is altering your technique, placing the back in a compromised position. Imagine the low back is a load-bearing column supporting a building. The column can easily support the most weight when it is in a vertical position. If you took that same column and gave it a bend, the amount of weight that it could support would decrease. And this decrease would exponentially increase as the angle increased. Of course, the low back isn't a perfectly straight column, it has a degree of natural curvature to it. But the fact remains that its neutral position, meaning that we're not bent forward or backwards, is the strongest and most stable for supporting weight. Many people who frequently lift weights will have some degree of tightening of their hips and ankles. Regular stretching can help to mitigate this. The problem is that many of us don't take the time to stretch before or after we lift. In the case of a squat, both the glutes and the adductors will limit how deep we can go. Once we hit this stopping point, the body will naturally look for a way to compensate to go deeper. The first compensation being forward flexion of the low back into a position that we call a butt wink. There is some debate as to whether or not a butt wink even matters. Now, when you're doing a bodyweight squat, where there isn't much force through the low back, it probably doesn't matter all that much. But if you're doing heavy barbell squats, then I believe that it definitely matters. Remember our example earlier about the support column. When the low back is pulled out of its neutral alignment, it loses its ability to support weight. So the more butt wink you have, the more compromised your back is, the more likely you are to get injured. To correct this, we need to add regular stretching of the hips throughout the day, as well as before we do any squatting. My favorite way to stretch out the glutes before I squat is to get into a deep lunge position and then try and get as deep as I can. To stretch out the adductors, there are many stretches you can do, but in this case, the specific adductor muscle we need to stretch is best targeted at the bottom of a squat. What I like to do is get into a deep, wide squat and then push my knees out. This stretch you should feel on the inside of your thighs. A tight ankle will also cause this forward bent position of the back when squatting. When we go deep, if the knee cannot move forward enough because the ankle is tight, our center of mass will stay farther back than it should. So in order to not fall over backwards, we then naturally lean forward, placing the back in this same position. The quick fix in this case will be to squat with your heels elevated on top of something. The better and more permanent long-term solution is to stretch out the calf with the knee bent. I like to do this off of a step. And there you have it, a few things to work on if you're having trouble with your back when squatting. I hope you found this video helpful, or at least somewhat enlightening. If you did, you might like this other video, where I talk about how a tight ankle can cause more joint issues than just in the back.